Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through some stretches and some things you can do to relieve the carpal tunnel syndrome pain that you're having. Carpal tunnel is generally a condition that comes from the wrist. However, if you suspect that you have this condition, you should get it diagnosed because quite often there will be problems at the elbow and also at the shoulder where those nerves are getting caught. So getting this checked out and figuring out exactly where the nerve is being impinged is essential to recovering from carpal tunnel. Some of the things that you can do right at your desk is change your workstation. You want to make sure that the carpal tunnel, which is located on your wrist, has enough room. If it's like this all day, if you're typing like this, you are cutting off the carpal tunnel. You are closing it down. You are going to develop carpal tunnel syndrome. Having your wrist in neutral so that the tendons and the nerves and the blood supply is able to flow through that area naturally is the optimal position. So whether you have to adjust your laptop or your desk height or your chair height in order to achieve that, the last thing you want to do is be typing either like this or like this. Some of the things you can do are a simple stretch. So what you want to do is you're going to grab your fingers and you're just going to pull your arm back. Now, if you experience increased tingling with this exercise, stop. If you experience increased pain, back off the amount that you're pulling on your fingers. It should feel good. You want a nice, gentle stretch. You may feel this just through here, up through here, or all the way into your shoulder. Hold it for 30 seconds and perform 6 of them. You may do that several times throughout the day. The next thing you can do is open up the carpal tunnel with just your fingers. So it's called a soft tissue mobilization technique, and all it is just putting pressure right on the carpal tunnel. Use your thumb, your fingers, whatever's comfortable for you, and go right along that area, pressing with moderate force to minimal force, not heavy force because everything's already inflamed and you don't want to irritate it anymore. The final thing that you need to concentrate on when you're dealing with carpal tunnel is your posture. You need to think about how you're sitting at your desk. Because again, if this type of issue is originating from your shoulder or your elbow or even your neck, how you're sitting all day long is going to affect the amount of tingling in your fingers. So two of the things that you can do are roll your shoulders up, back, and drop them down so they are in optimal position. Okay? Don't overcorrect and feel that you need to have your shoulder blades jammed all the way to the back. That's just as bad as being all the way / forward. The other thing you can do is get your neck in correct position. So in order to do this, you want to jut your head all the way forward and then all the way back and then find that middle point. You may have to jut your head forward, all the way forward and all the way back several times before you settle onto that middle point. Either way, correcting your posture is going to be healthiest for your discs, your shoulder, your elbow, and your wrist.